The cancer patient is considered just a bystander.
This is something down your throat, chemo, radiation, and that I thought that was my only option.
He's not considered an active participant in the healing process. He has to become knowledgeable. We're spending billions of dollars through the National Institutes of Health chasing genes. 1,700 people a day dying from cancer. And I talk to my students after each class. We've had about 70 people an hour in this country are dying from cancer. Every day I walk into my class for the last several years, I hold up a crisp $100 bill, and I say to the students, this is yours if you can show me a cancer cell that can survive and grow without glucose and glutamine. And these kids are like poring over the litter trying to find this, and nobody can find it. So therefore, and then I go to big, lectures at these medical schools. I do the same damn thing to these guys. They're all thinking it's a genetic disease. And if you think it's a genetic disease, you're not even thinking about this stuff. We're spending billions and billions of dollars on therapies that are all based on an incorrect theory. And that's the reason why we have the tragedy that we have. Just that the majority of people that work in cancer don't understand or know about the very biology of the disorder they're working with. And that's why we have 1,700 people a day dying from cancer, because the people that are working on the disorder are almost clueless as to the biology, and they're locked into this genetic thing. They all think cancer is a genetic disease, and when you're looking at the wrong thing, you're not going to make the progress that you should be making in managing the disease. So it targets glucose and glutamine is what the damn parasite medication is doing. So that's why you're doing so well. And it's and that's a cheap ass drug. You don't have to be spending hundreds of thousands of dollars to lose hair and all these other things. They can't grow in the absence of glucose and glutamine. So you can have other fatty acids, ketone bodies, other amino acids, and without glucose and glutamine, they don't grow. They can't grow, and they don't stay alive either. So that told us, with no uncertain terms, what these cancer cells need to stay alive. The parasite and the cancer cell are both using a fermentation mechanism to stay alive in the body. So that's why the drug that kills parasites kills cancer cells, because both the tumor cell and the parasite are using a similar process to generate ATP. You see, you have to realize our goal, my specific goal, and I wrote it for my book as well. I wrote my book for the sake of those who have all suffered and died from the misunderstanding of cancer. So the goal here for me is to keep my lab going, but the ultimate goal is to drop the death rate. Every longer-term survivor is a success story.
You just watched the best parts of the interview I set up with Professor Dr. Thomas Seyfried, one of the top cancer specialists on the globe. He saved thousands of lives. And my friend Kevin Hennings, who in September of 2021, after 3 years of chemo, his final doctor appointment, they said to him, Kevin, you've reached your 3-year maximum of chemotherapy. You need to call hospice now. He was on the phone with his nurse practitioner sister crying. He had cachexia, which is Holocaust survivor disease, where he was just skin and bone. And within 24 hours, 2 miracles happened, which I explain. If you look at my Rumble and my YouTube, you'll see the rest of the story. But look for me, Growth Factor, on Substack, on Rumble, YouTube, and Twitter. I'm not censored on Rumble and Twitter and Substack. I hope you subscribe to my channels. I hope you send this to family and friends. Even if they don't have a cancer diagnosis, they can save other family and friends. And here's the rest of the story. I hope you enjoyed the beginning, which is the best parts and the best summary. And here's the rest of the story.
What's the metabolic theory of cancer?
Metabolic theory of cancer, Kevin, is that this is a disorder that originates in the organelle called the mitochondrion, which is an organelle inside the cell that generates the energy for the cell. But it does more than that. It also controls the life cycle of the cell, the history of the cell, the stable environment of the cell. That organelle is ultimately the lifeblood of the individual cell. And when that organelle becomes corrupted chronically, it can lead to a dysregulation of cell growth, which is cancer. And I think you need to know that the definition of cancer is simply dysregulated cell growth or cell division out of control. That if people say, what is cancer? Cancer is just cell division out of control. How does that happen? And it happens through chronic disruption of the function of that organelle called the mitochondrion that controls the quiescent or resting state of the cell, as well as the energy metabolism within the cell and the majority of signaling events that occur within the cell. So it's an extremely important organelle. And as a matter of fact, it's like a second organism inside of one organism. They evolved a billion of years ago when oxygen first came onto the planet. And these two life forms fused together in a very rare and singular event, allowing us to form metazoan cells, organisms with multiple cells. So we couldn't have done that until the mitochondrion, the organism that eventually became the mitochondrion, first came about. It was the organism that could use oxygen to generate energy. Before that, when there was no oxygen in the atmosphere, everything was fermenting, a way of getting energy without oxygen. And the cancer cell is simply falling back. It lost that capability and simply falling back on these ancient pathways. And once you do that, they grow out of control, dysregulated cell growth. So once you understand how cancer happens, the organelle that's involved, and all this kind of biochemistry and biology, then you have a plan, a strategy to move forward with a more effective way to manage the disorder. That's a lot of science in a few statements that I made. But anybody who wants to break it down, I can break it down even further if necessary.
Well, you know what? It can't survive unless you feed it. So what's the two fuel sources that we're looking at here?
Yeah, well, this is a really important point. So you have to say, what are the fuels that can generate energy in the absence of oxygen? And, we just completed several years of work interrogating brain cancer cells to see what they could survive on. So the best way, the way that we did the study is we would take cancer cells and grow them in salt solution, which we call buffered salt, nothing. And then we would put the stopwatch on them and see how fast they croaked. They would all die. They got nothing to eat, right? Energy is everything. When there's no energy, things die. But it doesn't. If I grow them there, they're not dead in 5 minutes. They're dead in 24 hours. And human cells will last several days. Actually, it's unbelievable. Human cells just are so tough. To grow them, cancer cells, without anything, they're usually dead in 3 to 4 days with nothing. Okay, so then once you got that timing, then we start adding things back and find out what perks them up and what keeps them alive. So in other words, there's nothing in there. That they're going to die. So then we just add stuff back and see what keeps them alive. Yeah. And in this way, right, makes not a complicated strategy.
Everything what I do is pretty much based on logic and common sense.
Right, and nobody's done this. Yeah, nobody's done this because they think cancer is a genetic disease, so they're not looking at energy. We look at energy. So without energy, nothing can grow. You mentioned it right at the beginning. Without energy, everything's dead.
What does it eat?
I mean, try to drive your gasoline car with no gasoline in it. Doesn't work. There's no energy. It's not complicated. So the cell can't grow or live without energy. And that energy is ATP. It's adenosine triphosphate, the chemical source of energy in the cell. You have to have some fuel to make ATP. You need a fuel to make that. So we interrogated the cells to figure out what are the fuels that allow the cell to make energy. And we have a marker that knows it lights up when that makes ATP. So the more ATP, the higher the light goes on these cells. So they're alive because they're making light. You look at them, hey, look at them, they're not dead. And you add back. So it's not that. So what we did is we did all this, and we found out that they need the sugar glucose, that's for sure. and they need the amino acid glutamine. It's an amino acid in the bloodstream. It's our most abundant amino acid. And those two fuels, glucose and amino acid glutamine, together allow those cells to grow and live in the saline solution. Now, which is unbelievable, right? But if you want them to grow much faster, you throw in some serum and you throw in, cow serum, and oh man, they just light up. And
Sugars.
They already have the sugar. They have the main sugar, glucose. But there's a lot of other, what we call micronutrients, vitamins and all this kind of stuff.
Yeah.
And you threw that in there, and of course, they really grow fast. They grow out like really tough. But they can't grow in the absence of glucose and glutamine. So you can have other fatty acids, ketone bodies, other amino acids, and without glucose and glutamine, they don't grow. They can't grow, and they barely don't stay alive either. So that told us, with no uncertain terms, what these cancer cells need to stay alive. And I did a big deep dive on this several years ago to figure out, because those are the fermentable fuels. I said those fuels can get us ATP without oxygen. And we know all major cancers have a defect in this organelle called the mitochondrion, which uses oxygen to get energy. So the very organelle needed to generate energy through oxygen is defective, forcing the cell into this fermentation. So what are the fuels driving fermentation? The glucose and glutamine. How do you know? Because we interrogated the damn cells. The only thing they could live on were these two fuels. So the solution or a strategy for managing cancer, you transition the whole body over to fatty acids and ketones, which the normal cells, all our normal cells can switch over to this. The tumor cell can't because the mitochondria are defective. And then we target the glucose and glutamine. We've already transitioned the body over to a safe fuel. And now the cancer cell, the safe fuel that the tumor cells can't use. And now we just restrict the availability of glucose to glutamine to the whole body, which is protected by the fatty acids and ketones. And the tumors get degraded and the body turns on them and eats them.
Come on. Professor, please, are you trying? Am I to believe that the simple solution would be to starve the cancer? Well,
you're doing it strategically. It's not just starving the whole, but you're strategically starving the cancer, but not starving the whole body.
Yes.
The body is being transitioned to an alternative fuel.
So
say again?
So it's that simple.
I don't want to say it's that simple, but it's not as complicated as people make it out to be.
Okay. But in the entire explanation, nowhere in there did you indicate any. Well, you never mentioned the word parasitic. And I've heard a lot about cancer being parasitic. I've heard a lot about, and if I'm being honest, I don't know how much you know about me. Nice to meet you. But I actually had some success with taking fenbendazole and eradicating my disease. So with that being said, what do you think about that? I didn't just start taking fenbendazole. I completely changed my lifestyle according to your metabolic theory of how cancer's, invited into my life, sort of. So I'm so glad.
No, but I mean, let me explain to you exactly, as the best of our knowledge, why it works so well. We have a paper that's out now in bioarchives, which describes it's M-bendazole, which is a very close cousin of fenbendazole. As a matter of fact, they both work very, very similar. And you're right, Kevin. A lot of people get confused that they think cancer is a parasite because it responds so well to fenbendazole and M-bendazole and these kinds of things. But what we have found out is that because it's a dewormer kind of parasitic drug. It turns out that the parasite and the cancer cell are both using a fermentation mechanism to stay alive in the body. So that's why the drug that kills parasites kills cancer cells, because both the tumor cell and the parasite are using a similar process to generate ATP, generate energy. So it targets glucose and glutamine is what the damn parasite medication is doing. So that's why you're doing so well. It's and that's a cheap ass drug. You don't have to be spending hundreds of thousands of dollars to lose hair and all these other things. Now what you just described is we have a big treatment protocol that's under review, and one of the things we do is we bring the body into a nutritional state of ketosis, and then we use the fenbendazole, along with some other drugs that also are parasitic kind of targets, and these people are doing really, really well. Many of them are like yourself. I mean, I have dozens and dozens of guys that are doing just as well as you're doing. The problem is it's hard to write these damn things up for publication. And, I'm doing it, but it's an ass buster. Believe me, it's not easy to write a publication up when you're doing work with humans. So we do a lot of work with the preclinical mice to ferret out the molecular mechanisms by which this stuff is working. And then we give it to the patients, and they seem to do better than the damn mice do. So,
Doc, please, blowing my mind. So there is a correlation between the anti-parasitic medicine and, the dietary requirements of cancer.
Absolutely. Right? Yeah. I mean, there's no question. If you understand, here's the situation. If you understand the biology and the biochemistry of the disorder, and you've done the experiments and you've looked at the literature findings from the field, you know what's going on. This is not a great mystery. There's no conspiracy theory here. It's just that the majority of people that work in cancer don't understand or know about the very biology of the disorder they're working with. And that's why we have 1,700 people a day dying from cancer, because the people that are working on the disorder are almost clueless as to the biology, and they're locked into this genetic thing. They all think cancer is a genetic disease, and when you're looking at the wrong thing, you're not going to make the progress that you should be making in managing the disease. We don't like to use the term cure because we have no clue whether or not the metabolic therapy is going to cure anybody. But if we can keep people alive much, much longer than expected at a high quality of life, I consider that success. Whether they're cured or not, we don't know. But they certainly are alive with a better quality, like you. You look great. What's wrong with that? What is wrong with that? Why do we all feel we have to cure this disease when we can actually manage the disorder? And let's be honest, we're not doing a very good job either at managing or curing the disease right now. And knowing the biology of the disorder will make a huge impact in helping people live a lot longer with a higher quality of life.
So, I mean, so this is the problem that I have is I know exactly when the McRib is going to come out annually, like once a year or once every couple of years, McDonald's comes out with the McRib. Everybody, there's a line around the building for the McRib. Or go to Popeyes and try to get one of their special chicken sandwiches or something. There's a line around the people are murdering each other for a chicken sandwich. Why is it so hard? Who in the marketing world do I have to talk to get this message out?
Well, that's a good point. I think we're not going to stop McRibs or Popeyes or Chick-fil-A's or Taco Bells or any of these things that make people happy. I don't think we should tell people. We should just let them know what they should know. Because there's two things here. You always have to separate prevention from treatment. Cancer can be prevented with the appropriate diet and lifestyle, because it's abnormal diet and lifestyle that put you at the risk for dysregulated cell growth in the first place, type 2 diabetes and all these other chronic diseases. But without having when you have no knowledge to know this, then it becomes a problem. But if you have the knowledge, then you make personal choices and decisions as to how you would want to lead your life. Because I don't think government should come in and tell people they can't eat a McRib for fear that they're going to get cancer, right? Let's be honest. But if people know that if they chew on McRibs day and night, they could put themselves at risk for something that will be a big problem for them. But so I'm not into restricting. I'm into providing knowledge, and also if you do have dysregulated cell growth or cancer in some organ, at least you have a plan where the patient, the person themselves, can play a large role in the management of their disorder. with the assistance of a knowledgeable practitioner that can help them move from one step to the next. Right now, we have neither. And we need to show that cancer can be a manageable disease if done correctly. And I'm not throwing out all standards of care. I think some of these very toxic drugs that we give to folks that have cancer could be very, very effective in very low dosages. When the body is in nutritional ketosis, it turns out that a lot of these cancer drugs work even better. So we have, as I've said over and over again, we have a toolbox with a lot of tools. All the tools needed for long-term management and success of cancer are already developed. We don't need to develop anymore. They're already there. You just got to know how to use them and when to use them. And
the theory of living like a caveman or walking like they used to walk in biblical times, where they didn't have all the poisons and the whatever we're being fed nowadays, whether it be
it's a diet and lifestyle issue for sure. I mean, the biblical times, people did not have highways and jump into their electric cars or gasoline cars and go from. They had to pull donkeys and stuff. I mean, there was a lot of exercise associated with the past. There wasn't a McDonald's on every corner to get McRib. I mean, let's be honest, Dunkin' Donuts and all these things. I mean, we're eating ourselves to death here, but I call it the great American diet and lifestyle, our greatest contribution to the world health.
When you go to other countries and you used to think of insulting, that there's, you fat pig, you American.
Yeah. Listen, I see now that there's more obese people in China than anywhere else in the world. They've got 200 million obese people in China. Once you have the cultural exchange, baby, you start getting the effects.
There's a lot of convenience there. Right?
Oh yeah, convenient. Listen, we all like convenient. We all think things that taste good and they're convenient. Yeah. And but it puts us at risk. I mean, type 2 diabetes, dementia, macular degeneration, all these cancer, they're all related to the same cardiovascular disease. It's all chronic conditions that are all either reversible or preventable. And but I don't know. We have big industries that do well on this. But I don't want to stop anybody from selling anything. I just think that people just need to know about this stuff and whether they can choose or not choose. That's just the issue.
At the end of the day, we all have power of choice, right?
Yeah.
And that's not, I don't throw stones. Listen, I don't vilify Western medicine. My doctors were brilliant. They kept me alive. They kept me alive long enough for me to find a solution. Chemo, to me, chemo worked. It did exactly what it was supposed to do because I understand that it's not a curative thing. It's just to suppress things that, for a life. So, so I get it. And I'm grateful. And I don't vilify any, and I don't turn my nose. Geez, I'm taking horse right now. But I changed my lifestyle. I didn't start dieting or whatever. People fail at diets. I started doing things differently because I started listening to you mostly. So no offense, but
but I think we've explored the science behind a lot of this, and we understand why things work the way they do. And I should also point out that we're just beginning on this new journey into the right direction. The drugs and procedures that we have could work so much better if they were used in the appropriate way, and I think that's where a knowledge base has to come in. We, as I said, we have all the tools. We just need to know how to use them better. And the better is dosage, timing, and scheduling. Now, the National Cancer Institute, this is the other problem, of course, is that they think cancer is a genetic disease. And we've clearly shown that cannot be the case. We have so much evidence to show that that's not the case. It's hard to, and we're spending billions of dollars through the National Institutes of Health chasing genes. And we got 1,700 people a day dying from cancer, and when I talk to my students after each class, we've had about 70 people an hour in this country are dying from cancer, and we're spending billions and billions of dollars on therapies that are all based on an incorrect theory. And that's the reason why we have the tragedy that we have. Institutions themselves, they're under an incorrect theory. And this is at the foundational issue of what we're dealing with. Theory describing what's happening is incorrect, then the outcome of using therapies based on an incorrect theory will never be optimal. So once you realize it's a mitochondrial metabolic disease, then all of this, what I'm talking about, will make perfect sense, and we'll be able to move forward very rapidly in helping people live longer at a higher quality of life.
But I wanted to introduce that. I mean, that was actually on my list of questions to ask you. The curriculum that is in the med schools, the curriculum that the doctors are taught through medical school or whatever. It's my understanding Big Pharma kind of takes a role in writing that curriculum. And when you make the bullets and the Band-Aids, you're going to want to always stay at warm. Many solutions that you're suggesting has been suppressed.
They're not suppressed. I think you're right. They're just not discussed. It's not like they're suppressing anything. I don't know. It's been going on for decades. That medical students are given very little information on diet, nutrition, how to use food as medicine. And, they're procedurists. They use procedures and things like this, and they're well trained in doing that kind of stuff. And in medicine, diet has always been such an ambiguous thing. And we it's because it's so hard to pin down what might be present in someone's diet that might have had an important part in their healing. And they would always, with a drug, you can always more characterize better how that drug might be working in a trial. We ourselves tried to steer clear of the diet. We call it ketogenic metabolic therapy, which is a strategy that uses a variety of different approaches that selectively restrict glucose and glutamine while enhancing the health and vitality of the normal cells, which can involve diets sometimes. And what kind of diet? It could be almost anything. We've seen success with Mediterranean, pescatarian, vegetarian, carnivore diets. As long as you can get your blood sugar down or your ketones up, then you have your tumors are going to start to suffer. And then once we hit those zones, then we come in with the fenbendazole, the embendazoles, take on tremendous power when the body is already prepared and ready to have these drugs. And even some of the toxic chemos delivered at very low dosages under the strategic situation will also have tremendous benefit, as well as radiation under certain circumstances can have a benefit when you are in the right metabolic state of the body. So everything except the brain, none of our research encourages anybody to irradiate somebody's brain, but all other aspects are open.
Doc, I don't know if you're aware of this, but you're kind of validating everything that I've been preaching for the past years. I mean, I've never heard you say quite put. I've watched a lot of your interviews, and I've never heard you make this precise correlation. And I do agree with the.
Well, Kevin, the reason we do this is because I've got research next door testing all this stuff constantly. We're doing these experiments as we speak. So it's not like I'm pulling this out of my ass. I mean, we're doing the experiments next door, and we're validating it with literature findings from other studies. So
it's incredible, and I would 100% agree. I mean, that's everything about. An hour ago, my brother, who's a chiropractor, actually, he's my younger brother, and he says, "Oh, I got to go for this colonoscopy," right? And he says, I'm really, I'm trying to stay up on my colonoscopies and everything because you got the cancer, blah blah blah, I colorectal cancer. And so I said, "Listen, you're good, man." I said, "I invited this cancer into my life. Nowhere in my family tree did anybody ever have cancer. I'm the only one." And I kind of lived a toxic life. I almost begged for it. Yeah. I believe it's metabolic. It's not a genetic thing. I don't think you have anything to worry about. However, recently I did an interview with Dr. Jay Dunn, and Shay has this, I don't know if you've ever heard of the well, I'm sure you have it, the genetic testing. You get the genetic testing. And in theory, you're supposed to find what you're genetically deficient in, and you can take whatever supplements to rectify that, and in theory, control your own destiny, so to speak. How do you feel about that?
It's mostly bullshit, to be honest with you.
Oh, there you go. Come on now.
Why? Why would I say that? Because the genes are all downstream epiphenomena. They're not the cause of the cancer. They're effects. And if you pull the plug on the glucose and glutamine, it doesn't make any difference what genetic mutations you have. The damn cell's going to die. I hear that all the time, and we have to do all these genetic screens, and we have to do all that. The damn cell cannot live without glucose and glutamine. If you pull the plug on the ender, it doesn't make any damn difference what kind of mutations you have in the nucleus of that cell. We went through and showed this is the fallacy. And this is based on the somatic mutation theory, which is the dogmatic view of what cancer is. So you have all these screening guys screening this gene, that gene. Okay, so I take an immunotherapies are all based on the somatic mutation theory as well. So the bottom line is you can get every now and then the blind squirrel finds a nut, and some guy does really well taking one of these therapies. And I'll tell you what works. I mean, you target a a genetic mutation on a tumor, and some lung cancer patients, you get 20% that will do well. Maybe 60% doesn't do anything, and then there's 20% where the drug will kill you faster than the cancer does. The problem here is the mutations are red herrings. They're something that people think are important. They have no relevance, very little, if any, relevance. Another thing about these mutations is that when the cell collects all the mutations in the nucleus of the cell, they become inflex. They can't adapt. Adaptive versatility is prevented by the accumulation of mutations. That's why they cannot adapt to the glucose glutamine targeting. So we've looked into all this. Yeah, that sounds good. Oh, you got the ERK mutation, you got the FDH mutation, you got that mutation, you got this mutation. All we know is when we kill the two, when they can't live without energy. Once the plug is pulled, the damn cells die.
Now, I've heard and read that there's been studies that also those cancer cells cannot adapt to the fenbendazole or embendazole or whatever, bendazole. Is that an accurate statement that cancer, as I understand it, a cancer cell can adapt to the chemotherapy and stuff over time. That's why they have to continue to change the medicine for it to be effective. Whereas with fenbendazole, it cannot adapt to that. But I don't know, is that an accurate statement?
They adapt to chemo because you've never targeted glucose and glutamine in the microenvironment. That becomes clear. Whether they can adapt or not to embendazole or fenbendazole is ambiguous. We haven't tested that yet. So it's hard to say. I don't like to rely on one kind of a drug. I use oxynorlucine, and we should be having, that's a powerful drug, much more powerful than embendazole and fenbendazole. Yeah, oxynorlucine. It was an antibiotic. It was isolated in the 1950s, purified, and it's a glutamine targeting drug. As I said, that's the other thing you have to realize. The targeting of glutamine has to be done very strategically and carefully, because the glucose we can push down really, really low, because glucose is a non-essential metabolite. We can transition to ketones and fatty acids to replace the glucose. But the glutamine is very, very important in our body. It controls the gut, our gut health. Our immune system uses glutamine, and our urea cycle. So when we target like fenbendazole, you like to speak about that, embendazole. That's a mild glutamine targeting. It's a mild. It targets both glucose and glutamine mildly. It's not like a big hammer. It slows them down. The dawn is the hammer, okay? But the hammer has to be. You don't want to keep clubbing because the next thing you kill the patient. So you have to know. It's not going to kill the patient, but it's going to make the gut bad and it's going to have some effects. We choke hold glucose, and then we go after the glutamine. Now you can throw in the embendazole because that's doing both, but it's not really restricting the glutamine to the extent that you would like to have it. That's why we sprinkle in a little bit of Don just to push the embendazole. What I'm giving you is the damn strategy for managing cancer without making any money on this for myself. I just told you what I'm telling you. Yeah, if people were smart, they would run out and take with the words that I just said and open up a huge corporation, a company to treat cancer patients, right?
I feel like I just have the golden ticket now. Like this is a Wonka event.
You see, you have to realize our goal, my specific goal, and I wrote it for my book as well. I wrote my book for the sake of those who have all suffered and died from the misunderstanding of cancer. So the goal here for me is to keep my lab going, but the ultimate goal is to drop the death rate. Every longer-term survivor is a success story, and that is plenty of reward in itself. Like yourself and many others, all these people come up and say, I'm still alive, I'm doing well. I was given 6 months to live, and I'm out there. That's my success. If you have a theory, and that was Warburg's theory, and he was the German guy who really started all this. I just showed that he was right and expanded even more to what he knew. He had the idea a long time ago, and I just followed it up. And knowing that your theory is correct because you have living people who are not bald, they're not bleeding from all orifices, they're not having a blown out microbiome, and they're alive. Is that not enough success? What the hell more do you need? We talk a lot about it on my publications. 6-deoxynorlucine. It's a complicated name. It looks just like glutamine. If I were to hold up the structure of the glutamine amino acid and the Don, you would say, they're almost the same. They look almost the same, but they're structurally slightly different. And they said, Don, we can't use Don. That's the acronym for the chemical structure.
Okay.
We can't. It's 6-deoxynorlucine. It's Don, D-O-N. We can't use that because it was too toxic. Well, if you don't know how to use anything, it can be very toxic. The question is, they were using it they were dumping it on people, and they were not targeting glucose at the same time. They weren't bringing the patients into nutritional ketosis. So they were not using the drug the way it should have been used. Once we realized the whole strategy, now we know how to use Don in the correct way. It's not that toxic at all when you use it the right way. And when you do it in the whole package like we have, and with the embendazole and the fenbendazole, and you can put this whole package together, and it's called doses time. It's a strategic strategy. And boy, I'll tell you, man, I'm even shocked at how well some of these people do on this stuff without. Now, you say, all it is knowledge, man. You just got to know the biology of what you're doing, and all this stuff makes perfect sense, and it works.
You're probably the easiest interview I've ever done because I feel like you're my best friend.
Well, I talk every day. I walk into my class for the last several years, and I hold up a crisp $100 bill, and I say to the students, "This is yours if you can show me a cancer cell that can survive and grow without glucose and glutamine." And these kids are like pouring over the litter trying to find this, and nobody can find it. So therefore, and then I go to big, lectures at these medical schools, and I do the same damn thing to these guys. They're sitting there. I says, okay, show me a cell that can survive and grow without glucose and glutamine. They'll sit there. They're all thinking it's a genetic disease. And if you think it's a genetic disease, you're not even thinking about this stuff. Well, that's the craziness. And people will say, oh, man, well, how you know all this stuff? Because I busted my ass for 40 years looking at this stuff. What do you think? It just came over yesterday?
How loud do you have to scream?
Well, I don't know. Why don't you ask all the survivors that should have been dead? Talk to Pablo Kelly, a glioblastoma guy entering 10th years of survival. No radiation, no chemo, none of this stuff. And what about the dogs that are doing really well in metabolic therapy? There's stuff. So what about the mice? Nobody talks about my mice that are, I can be honest with you.
Do you like mice?
We've never cured a mouse with my brain tumors, and the mice that we developed, the mouse are tough because the whole happens in like super fast time, and we never. Everybody said, "Oh, you can cure the mice." These guys say this stuff. They have no clue what the hell they're talking about. The mice they cure are these genetically engineered things that don't exist in the real world. So
my doctors at Moffitt Cancer Center told me directly that cancer does not feed on sugar.
What?
They told me absolutely. They said in a laboratory, yes, but your body has filtration systems put into place. Don't worry about it. Eat whatever you want.
That's the height of ignorance. Those guys should lose their license.
Sure, but because there's this thing called the World Wide Web, and it's really starting to catch on. Well, if you Google cancer, the word sugar, glucose, glutamate, all of it comes up.
Yeah.
Right when you go.
Okay, grow your cells with no glucose. See how long they grow.
Well, I'm saying, I mean, why would somebody suggest such a thing when?
Because they don't read the literature. They don't understand the biology. That's not their fault. That's another thing. It's the system itself let them down. Well, those guys came into the profession thinking they're going to help people. And many of them, if you're doing hip replacements and shoulder replacements, those guys are supreme in their skills, and many other skills. Heart surgeons, these guys, they're very, very skilled in so many ways. But when it comes to chronic diseases, they have very little understanding of what causes chronic disease. And when the dogma says that cancer is a genetic disease by the National Cancer Institute, the American Cancer Society, and all these societies telling everyone that this is a genetic disease, brainwashing. I call it dogma. And it's wrong. It's not right. Warburg was right. It's a mitochondrial metabolic disease. I've proven Warburg is right. And we've expanded it, and the people are showing that. And when you treat with a disease the way it should be treated, the outcome is superior, much better. The problem is nobody's doing this.
What I do know is what I've lived through, what I've done myself, and I'm more convinced now than I ever had been convinced before that this is absolutely in my hands. And I think I think it's imperative that everybody is the captain of their own vessel. And I think that, well, let me ask you this. You do a Cologuard, one of those mail-in, poop bag, whatever it is, and you just get a phone call, the results are in, you have colorectal cancer tomorrow. What do you do?
What we do is we go on a zero-carb diet for about 10 to 14 days. We bring the sugar down as the result of that. Ketones go up, and then we jump into a water-only fast for about 7 days. Now your body is adjusted to this, and then we do what you did with the embendazole, fenbendazole, and we monitor it. And we look at PET scans, MRIs. We use the conventional ways of assessing we have to have the accurate diagnosis. I don't do biopsies because that could potentially spread the cancer around. So what we do is we have PET scans, MRIs, CAT scan. We have a lot of different non-invasive imaging technology. We have blood work. Becomes stable. It can either I've never seen it grow. It either becomes indolent, less aggressive, quiescent, or just disappears completely. It doesn't disappear and it remains and hangs on. Then we can do a complete surgical debulking of the lesion that you see. And then we transition back to the metabolic state, and we just monitor the patient and see how long they do for as long as they do. And if it doesn't come back, like Pablo Kelly is not cured. Pablo was the glioblastoma guy. He has a web, he's telling everybody. So he was diagnosed in 2014 with a glioblastoma, and they wanted to give him it was inoperable. Okay, I'm sorry, it was such a bad tumor. It was in an area where we couldn't operate on it, but they wanted to do radiation and chemo. And if he didn't do that, they said you wouldn't probably live more than a year at the most. He rejected. And then he went on the metabolic therapy, no radiation, no chemo. And then all of a sudden, after 2.5 years, his inoperable tumor now became operable. Wow. So they cut it out, and he felt he was cured. He wasn't. He went back on some loose ways of diet and lifestyle. And all of a sudden, the imaging came back saying, whoa, it's coming back. Put the fear of God back into him. He goes back on the metabolic therapy. Another 3 years go by, and all of a sudden, this indolent, this thing that was going to kill him is growing slow. They took it out again. And now he's just recovering from his third operation of an inoperable tumor. Now, since the time he was diagnosed, he's got married, he has 2 kids, and he's doing fine. He's in Devon, England, and he's still alive. And he never did the conventional standards of care. And so he's now, is he cured? No, he's not cured. But do you know how rare it is for people with glioblastoma to be living 10 years?
Is it?
It's very, very rare. And they're all telling him, oh, he's a fluke. He's an exception. Why don't you try other people? See how many flukes we'll find if you do what Pablo did. And now we even have better strategies. He never took Don. He never took the drugs that we know can work even better. So as I said, dosage, timing, and scheduling. We're just at the beginning of the resolution of cancer or its long-term management. It's going to be the way we treat cancer in the future once we drop this crazy stuff thinking cancer is a genetic disease. The theory has to change.
With the influence of Big Pharma making money on their cures and their indoctrination is where it all begins.
Well, as I said, the business of America is business, right? People are making money, a lot of money. I had a head pharma guy come into my office, one of the top guys from Bristol Myers Squibb, one of these big, big companies. And I thought he wanted to talk about, strategies, biochemistry of cancer. I thought because he's the guy developing all these very expensive drugs from his big organization. He says to me, I got prostate cancer. Can you help me? And I'm saying to myself, what the hell, man? You have all these billion-dollar drugs, and now you want metabolic therapy. We're not throwing out all that stuff. Of immunotherapies, and if you do metabolic therapy, and you now had a big angry tumor, and now it's this little thing, small indolent thing, but we can't get rid of it. They may all have something in common, and you have an immunotherapy that comes in and wipes that thing out right away with a very strategic plan. Then that uses that tool in the right way, rather than trying to attack a large heterogeneous mass with a therapy that only hits a few of the cells. Why don't we shrink it down, and then you've got a few survivors that must have something in common, and an immunotherapy that will target them all, boom, you're gone. Those cancer cells cannot survive without the fuel and the energy, and they become vulnerable to all kinds of other approaches.
I think the keep it simple, so the KISS method or whatever, I really just to dumb it down and make it just logical and common sense. It's the most fundamental approach, and it's the only approach that has been shown to actually work, I think.
It does. It works great. And I'm even shocked. Sometimes I can't even believe how well it works. But, sometimes you can't get, I feel so bad for the poor folks that email me from hospice, and they're so desperate, and their bodies have been beat to hell, radiation and chemo and all kinds of stuff. And you need, at the beginning, when your cells are strong and your body is resilient, is when you can really clamp down on these tumors. You can switch the whole battlefield to your favor rather than their favor. Metabolic therapy should be done first, and then you can bring in the other things to finish off the job. So, but you're talking about a paradigm change that's too steep for anybody to accept right now. But it takes time for the brain and the society and the outcomes to be realized before the system begins to change.
There's a chance that this may fix itself. I mean, they said that the fast food meal deals are going up to like $25-$30 a pop. So maybe that'll deter people from going to that source of diet and encourage people to do something more natural, whatever, if it's less toxic.
Yeah, well, I think so. That's, again, prevention. But the blood sugar levels clearly indicate, and as a matter of fact, when you say there's no, we have shown in all the major cancers, there's a direct, the studies are published showing a direct correlation between how fast your tumor will grow and how high your blood sugar is. I mean, it's been done. It's been done for all the major cancers. Has been shown that the patient outcome is the poorest when the blood sugar remains the highest. And our funding comes largely from private foundations and philanthropy. You know, there are some people out there that really want to be part of this. And they don't care if they make $1 billion on it. They just want to say, want to be part of a new movement.
I think everybody touched. Everybody's life is touched by cancer. I mean, but the thing is that when you just blindly follow one theory without exploring all the theories, you eliminate your freedom of choice. And you actually, I mean, look at the royal families infested. All of Hollywood out there is infested with cancer. I hope cancers everywhere.
Yeah. And I don't like these conspiracy theories that people say, oh, we have a cure for cancer, but nobody wants it. You know, that's bullshit. Cancer is the management is going to involve the person's own, like what you just said, what you've done and how you've done it. That's the strategy. There's no hiding of this. There's no, we have something that would work. I mean, let's look at John McCain. Let's look at Teddy Kennedy. Let's look at President Biden's son. If they had a cure for cancer, these folks would have gotten it a long time ago. So the idea is that cancer is a manageable disease. It takes it involves the person as well as strategic use of diets and drugs at the appropriate time, and that will be the turning point when we start to get this disorder under control.
Spread the word to support your cause.
We have a lot of papers, open access on the web. So all you have to do is put my name into the web. Press Pulse Therapeutic Strategy was the framework upon which metabolic therapy will eventually replace all parts, majority of standard of care. It's there. It's just that it's not implemented in hospitals at this point in time because there has to be a reconfiguration of revenue. How are we going to implement metabolic therapy to continue revenue streams and best outcome for patients? So I think there's a lot of parts of the process that need to be reevaluated and adjusted so that we can bring this new effective therapy into the hospital so the majority of people can have access to this. And they themselves must know they are going to be key participants in the outcome, which is not what we do today. The cancer patient is considered just a bystander, and he's not considered an active participant in the healing process. And he has to become knowledgeable on why he's doing what he's doing. And so all of this has to take place. Physicians need to be trained. They need to know what to do and how to do it and why they're doing what they're doing. The patients need to understand this. The drug companies need to come in and adapt their drug policies to this new strategy. So this all has to be a part of the change. We're just putting the framework and the path to get to this place. But eventually we'll all get there, and people will be benefited tremendously from this.
Fentanyl is all suppressed. Well, it is censored a lot on social media stuff for medical misinformation. But I mean, in society in general, I don't think it's frowned upon as much because everybody knows you have cancer, you throw the kitchen sink, whatever. There's desperation involved. There's all sorts of stuff that people do crazy stuff for whatever reasons. But I do think that, at the end of the day, we have the will of choice. Mm-hmm. Now, with this information, we have an option to choose. Before, it was just, this is something down your throat, chemo, radiation, and that I thought that was my only option. Mm-hmm. When I got diagnosed, I thought, okay, I'm in for the ride. I was in the right part. My government's not specialty. Mm-hmm. I'm not saying that, listen, I'm grateful for everything, and I'm just so grateful that now this information is on the surface and people have the power of choice.
Yeah. Sounds good.
Hey, Dr. Professor Seyfried, I just am, this was everything that I anticipated it would be. So grateful for your time. Is there some place where people could see something regular on you?
There's a lot of YouTube videos out there and this kind of thing, and we're publishing all the time. Our research, new stuff comes out from our lab all the time, and we're working on a big program to help little kids with high-grade gliomas. We've developed the best model system for testing that, and it's so tragic when you see these little kids dying from these brain tumors. And we're able to, I think we can keep these kids alive so much better. I think the parents would be so grateful for this if we could just get it put into the clinic, which is another thing why we don't immediately adapt this to the clinic, because our preclinical studies show such with embendazole, fenbendazole, just the same stuff I just described to you. It really works on pediatric brain. It's unbelievable.
Yes.
So we need to get this stuff out. People need to know about this. Let them make the choices. You want radiation and chemo standard of care, by all means, they'll be there happy to deliver it. But if they have what you want, metabolic therapy or some hybrid system, they should at least know about it.
Exactly.
Not saying you can eat whatever you want. That's the worst thing you can tell someone.
Yeah. I mean, they were more concerned about me losing weight than they were concerned about me feeding the cancer.
That's another whole issue about the cachexia and all that. We've looked into all that. We know all about that. Travis Christofferson's Foundation for Cancer Metabolic Therapies supports our work. People make donations to his foundation. People can make donations to my research right through the Boston College. My webpage has a donation site right on it at the university.
Well, Doc, you sure are doing God's work, and you're definitely doing your part. I see you on the podcast circuit, and I know you're putting out paper after paper, research and all this stuff. You definitely are doing God's work, and absolutely your part. So hopefully this platform could catapult that knowledge out there, and we'll try to do it together, one episode at a time.
Well, that sounds great. Thank you very much, Kevin.
Thank you so much for your time. I appreciate it.